to Healthy You in 22. This is our second Chamber University programming of the year, and on behalf of our educators today and the Chamber, we are delighted to offer this educational event for you. I'm Kristen Milashowski, Member Relations and Business Development here at your Fountain Hills Chamber of Commerce. We're enthusiastic about showcasing our outstanding member educators this morning, and it's also great to be able to provide complimentary content such as this to our community. Because of course you all know the more we learn, the more we know, and the better quality of life within our community. Educating us today are a very knowledgeable, skilled group of professionals. They've been vetted, and I know they've planned and organized because I've been at those meetings, and they are really going to present some really thought-provoking content for you today. I must say these individuals are all excellent communicators, and I know that they can speak for a long period of time about their area. Out of courtesy to each of them, we're giving them 15 minutes to share their expertise and knowledge with us this morning. And educators, please know I will be keeping time, so don't be offended if you hear the buzzer go off and you're still talking. It's simply out of courtesy to make sure everyone has enough time to share with our guests today. In front of you is a packet full of information provided by our presenters, along with a highlight sheet about your Fountain Hills Chamber of Commerce, a little bit more about who we are and what we're doing in the community, as well as some promotional items from the businesses. Those are all yours to take. A few quick items to know before we get started. Courtesy of Fountain Hills Healthy Heartbeats, please help yourself to coffee and tea out in the hallway as we chat and talk today, and refills to any of the Healthy Bites that are back in the corner as well. There's some great snacks and drinks available. There's 3 restrooms here at the Chamber. One is at the end of the hall through the room with the window with the copier. It's on the right-hand side, and then there's 2 downstairs as well. And then, of course, there is an elevator here in the middle, or the steps. You can go up or down either way. And then, if there's no other questions, I think we can go ahead and get started. Good? All right. So let's go ahead and let me introduce our first educator today. We're going to hear from Dr. Scott Schleifer from the Fountain Hills Emergency Room and Medical Center. Dr. Schleifer was born and raised in New York City. He attended the University of Florida as an undergrad and went on to Nova Southeastern University Medical School. Following medical school, he trained in New York City. Dr. Schleifer is board certified in emergency medicine and has spent over 21 years at Banner Desert in the emergency department. He is currently the Vice President of Operations and Emergency Medicine Director at the Fountain Hills Emergency Room and Medical Center. Dr. Schleifer.
Thank you for having us, our facility, and myself. Thank you to the Chamber and everybody else, and the experts that will be talking to you. Excuse me if I'm a little raspy, I just finished the night shift, so I'll try and be brief and everything. So, I know you sent out a pack, and I believe you have a list of reasons why to come to the emergency room. Somebody says, when do I go to the ER? Right there is the question. That's it. If you say that phrase, you go to the emergency room. There's nothing too small. There's nothing too big that an emergency room cannot handle. Our emergency room has all state-of-the-art CT scan, X-ray, ultrasound, blood work, immediate results that we can do. We can do the same thing that any big major hospital at Banner Desert, Honor Health, Dignity can do in our emergency room here in our community. We can do all the testing, get all the results, usually within 30 minutes to an hour, even with radiology reading the CT scans. So it's really nice to have that in the community here. Just wanted to go over a few things that people always worry about, like why should I go to the emergency department? And those are usually your big areas of chest pain, shortness of breath, and dizziness, headache, that kind of issues. That's the ones that really are forefront to people that get them a little concerned. So obviously there's chest pain, and everybody always thinks of the classic chest pain. I have pain in my heart, goes down my arm, get a little sweaty, and that is your classic. However, what people don't understand and why an emergency room is great is you have board certified. We have boards. All our doctors are board certified. However, I see a lot of women here, but believe it or not, sometimes women only present with a heart attack and all they have is a toothache. So women don't present like men. So it's really important to say, where am I going to go where somebody has seen something, knows something, and can look at something immediately? EKG, troponin, all cardiac enzymes that can be done right away. And our emergency room, just like any other emergency room, can do that. Most people say, oh, it's just indigestion. Well, that would be great. We have one anecdotal story. Right when we first opened, it was one of my first patients. He was an 80-some-year-old gentleman. They were driving back to, I believe, Wisconsin, and he was somewhere on the 87. Came in, he went to a fish fry on Friday night. And he stopped at our place, and he was having an acute heart attack. And he said if he had to drive any further somewhere else, he was just going to keep going to Wisconsin. He might not make it. So we were able to stabilize him, transfer him. We got a cath, we got a nice card. He's doing great. Made it home for the summer. So those are some things to think about. So most of the time it's indigestion, but if you ever get that little voice in your head, just get checked out, and we'd be happy to do it. And that's what we're there for. We're there for you come in, if everything checks out fine, you get a peace of mind, you go home, and then you follow up with your doctor and say, okay, why am I having indigestion? So something. Also, one of the things that we most commonly see is fast heart rates, tachycardia. But the number one cause also could be an arrhythmia that we call atrial fibrillation. So if anyone feels their heart rate going fast, it could be an irregularity that we call atrial fibrillation. And if that's the case, there's medicine we can give, medicine we can start. And the trend now is no longer being admitted to a major hospital. If you meet certain criteria, there's medicines out there now. We can control the rate, put you on special medicine, and you follow up with your doctor, you go home. The reason you want to get checked out, though, is if you are in atrial fibrillation, you're running 3 to 4 times the risk of having a stroke than if you don't do anything. And there's no real way to tell. We can EKG monitoring, and all that can be done at our emergency room. The other big one is shortness of breath. Most commonly, people think of shortness of breath as we all get older. Our hearts get a little bit bigger, or just that's the way it is. And sometimes fluid leaks, and it sounds like congestive heart failure. You ever notice, like, why do people's legs swell sometimes? So that's one thing to think about, is like, am I developing congestive heart failure? And we can easily do chest x-ray, there's blood work, there's IV medication we can give to help with that. And then sometimes it's just good old-fashioned dependent edema, just Arizona heat. You're out, we're walking about, our legs swell, everybody knows, you put them up, the morning they look great, and then as the day goes on you swell, and then the next day it's that. But that could be the beginnings also of heart failure. So there's testing that can be done at our facility, and to look into that to make sure, because if it goes undiagnosed, heart failure can lead to another heart attack, and then can lead to what we call pulmonary edema, where your lungs fill up. So it's nice to get checked out. Don't wait till the last minute. Other reasons for shortness of breath, we talked about heart attacks. Everybody knows lives clammy short. But another big thing is, they call it the great masquerader when we're trading, is pulmonary embolisms. And we have a lot of people who travel back and forth to summer homes, winter homes, and driving for long periods of time. And that tends to lead to blood clots. You get the wrong blood clot, it travels up through the leg or anywhere in the body, can lodge into one of the pulmonary arteries. And with that, you just may have a cough, you just may have shortness of breath. Believe it or not, you could just have a fever. And this can lend to a blood clot in the lung. Number one sign of having a blood clot is you have a fast heart rate sometimes, but not every time. Now they're finding out that generalized obesity also tends to just have a blood clot as well for no unknown reason, and people can have healthy veins. So another reason, if you feel like your breathing is just not right, that's something we do special testing, CT scan, blood work, that kind of thing, and we can look for these things. Pneumonia, COVID's big, but believe it or not, regular pneumonia is coming back now that we're socializing. So we're getting our regular, normal disease patterns coming back, but COVID is still out there. And we still do get a few people with COVID pneumonia. We get bacterial pneumonia. There could be valley fever. There's other viral pneumonia as well. So another reason, if you have shortness of breath, little fever, or something, or even if you just say, something doesn't feel right with me, that's the time to go to the ER, right? Because something just doesn't feel right. Get it checked out. We can do everything, and like I said, 99% of the time, we'll get all the test results back before you even go home or have to be transferred. The last thing I want to talk about is a lot of people are on blood thinners now. The new wave is people are getting moved off of Coumadin and into these newer generation blood thinners, which are great. They don't have to be tested or anything like that. However, if you are on any type of blood thinner, and believe it or not, aspirin is it's not technically a blood thinner, but the way it acts, we'll consider it in the range of blood thinners. And if somebody falls and hits their head, especially as we get older, it tends to lead blood in the brain, and you can get a what we call subdural hematoma or epidural hematomas, or bleeding inside the ventricles. That's just little spaces that we have in the brain. And that's another reason to get checked out. If you have a hard fall or hit, 8-9 times out of 10, it's going to be normal. But we have probably transferred in the first year, I'd say close to 10 to almost 20 patients with intracranial bleeding.
Wow.
That patients have fallen, walk in the fountain, do something, and they have a small bleed. 9 times out of 10, they do great. You just have to watch them. They go to a trauma center, you repeat a CT scan 24 hours, and if the bleeding is stable, they go home. But just something to think about if you or any family members are on any of these blood thinners. A lot of people check in and say, "Are you on blood thinner?" No. They say, "Are you taking aspirin?" I'm like, "Oh yeah, I am." So just remind people that aspirin also can tend to lead to this as well. One other thing, I know it's a big golf community, right? A lot of people play golf. You gotta worry about dehydration. Some people get dehydrated. It leads to headaches sometimes leads to a little bit of dizziness. Most of the time, again, 9 times out of 10, it's probably just good old-fashioned dehydration. We can hydrate you up. We can check your kidney functions, because that's the most important thing when you're dehydrated. You want to make sure you're not in acute renal failure. We can take care of that, multiple IVs, keep checking labs. However, in rare cases, we have some tiny arteries and veins in the back of our spine, and doctor can attest to that. And these can sometimes cause small little dissections. And what that leads to is just simple dizziness. And if you go to somebody who just says, "Oh, you're just dizzy, just take this," you do have to think about sometimes what we call it's a posterior stroke. Lends to the only symptom that you have is dizziness. So it's good to go to a trained professional who can say, is this vertigo? Is this dizziness? Sometimes we don't know, but we can do a CT scan, do it with IV contrast, and we can see if there's a dissection in the arteries or veins in that area and determine what the cause of dizziness is. Your CT's normal, you try some medication, you feel better, and you get to go home. But we can get all these results real time. You don't have to be sent to another center, you don't have to be sent to a lab. We do all this real time. So, I probably hope I'm not scaring anybody. I'm just trying to get people, everybody knows the classics, and the answer is true. Most things happen most often. That is the truth. But sometimes these outliers do happen, and we do see them in the community. We do see them in a retirement community, a very active community as well. So these are things that, everyone should just think about. So that's why I say, when people say, "Oh, it's just indigestion. Oh, I'm just a little dizzy." Most time it probably is. But at any time, if anybody just says, "It doesn't feel right," come to the ER. We'll be happy to take care of you. So, I'm sorry. I just wanted to hit some big hitters. Some things they don't tell you, or some things people don't think about. So, any questions or?
I have a question.
Yes.
Pulmonary embolism,
Yes.
is that something that's hereditary?
Yes, can be. So there's blood factors, I won't bore you, CNS, antithyroid. There are blood clotting factors that are hereditary, and believe it or not, there are blood clotting factors that we don't know that we have ourselves. So that is another reason that to get checked out if you're having any kind of shortness of breath, because sometimes we just don't know until one forms. But yes, it can be hereditary.
I have 2 grandsons that are close to 30, and both of them wound up going to the hospital for that very same reason.
Yeah, they probably have a CNS deficiency or an
And
antithyroid.
they're on blood thinners, is
Yeah.
that what they're supposed to?
Yes, absolutely, and we can do all that.
Thank you.
Yes. Yes, sir.
What's your opinion on plant-based blood thinners, like nanokinase?
I don't know, that's not I think we have someone else who's an expert on that. That's gonna talk. That's not what I'm trained in.
Okay.
So I can't really speak to that. I can only do what I'm trained in. So if you come to see me, I can't do that. It's not what I studied. So I don't want to give any false information. But I do know if you're taking preventative medicine, I don't see why that can't help at all. I mean, I think it would be a wonderful thing. Yes, ma'am.
Dr. Scott, so when people go to our emergency room, then if they need a hospital admission, then you transport them like to Honor Health?
So yeah, so we have.
Or do you have patient care beds?
Well, yes, great, thank you. So we have 5 observation beds, and we can keep people up to 24 hours. And then if they require anything after 24 hours stay, they have to be transferred to a tertiary care hospital. We have major agreements with all the hospitals, Banner, Honor Health, Mayo Clinic, Abrazo. And during COVID, if any of you, unfortunately, if you know anyone that might be transferred, it's a nightmare getting people in. We just had a lady call this morning, asked if we can do emergency stuff, because she was at Banner and it was a 9-hour wait. This morning. I'm glad I left. I was there for 21 and a half years. But we also had someone come in, had surgery at Honor Health, and he was there last night, and it was a 3.5-hour wait. Wow. So came right, so 90-something% of the time we get you right into a room. Sometimes there's a little bit of a wait, but I mean, now that COVID has died down a little bit, I don't think we've had anybody waiting more than 25, 30 minutes. And that's usually just because we have to clean the rooms and, sterilize everything to bring the next person in. Some people are a little impatient and get a little upset, but once you explain to them, we just can't bring them into a room when somebody leaves, have to change the sheets and everything. Then they're like, oh, okay, I understand. But yeah, so I think it's a great thing for the community. We've had some really great responses. I think the doctors and nurses love being there, and I think the patients are enjoying it.
I just want to give a plug from friends and neighbors that have had events, a fall, a trip, a friend who fell off a ladder, another neighbor who hit his head on a rock. These are things and went right there. I mean, you're right on the corner there, and they couldn't have spoken any higher. So
thank you. That's very kind. I do appreciate that. Thank you.
Are there any other questions?
Thank you.
All right.
I just want to say, I work the night shift, and I want to apologize to the other specialists. I'd love to hear what you say. But I have to be back over tonight, so maybe I can come back.
We're not going anywhere.
When there's another event, but I don't want to seem rude. I just have to be back at work tonight. So
We certainly understand.
Thank you for your time. Thank you. It's good to see you. Thank you. Nice to meet you.
All right, everyone. That was great from Fountain Hills Medical Center. In between our speakers today, we're going to do a quick drawing. Everyone has a ticket at their seat, and I have put them all in our basket here. So we have some wonderful giveaways from our educators today. We have a basket here from Fountain Hills Healthy Heartbeats. Do you want to share what's in there now, or would you like to?
I think I want
You want to be a surprise?
plant-based food helper and enjoy.
Okay, awesome. We also have a gift basket from Joyful Life Hypnotherapy, along with a couple of as separate drawings, a gift certificate for a discounted session. Is that right?
Yes,
Rosemary?
there's 2 $50 gift certificates, and in the basket is an entire hypnotherapy session and a candle and some other fun things.
Wonderful, wonderful. And then we also have something from Ally Spine Center. Dr. Condon, can you share what's in there?
Yes, that's to be redeemed for a complimentary initial examination, x-rays, and first adjustment.
All right, wonderful. So the ticket we draw here, you will be able to choose from one of these, and then at the end we'll draw for anything that is remaining. So number, it ends in 8833. Does anyone have 8833? No? Got some extra tickets in there. How about 8845? No? That was my neighbor. Stepped out for 8841?
What is it?
8841.
Nope.
Alrighty. 8847.
Okay.
You snooze, you lose.
Yeah.
I know.
8816.
This is kind of
We gotta be good there.
This is it. This is it.
8834.
So.
No? That's what I get for taking too many tickets apart, right? 8842.
Yeah.
All right. Mother Earth, okay. Wonderful. Congratulations. You are. You're welcome. Okay, everyone, we're going to move along to our second educator today. I would like to introduce Dr. Condon with Ally Spine Center. Dr. Christopher Condon is a licensed, board-certified chiropractic physician. He has practiced for over 22 years and specializes in non-surgical spinal decompression and spinal corrective care. Dr. Condon has worked with professional athletes, musicians, and patients with chronic pain from around the world. He opened Ally Spine Center in December of 2020, where he helps patients eliminate pain by correcting the cause. Dr. Condon?
Okay. All right, thank you so much. Good morning, everyone.
Good morning.
So, since it's healthy, and by the way, I want to say thank you to the Chamber, Kristen, and the whole team. Appreciate being here and all of you being here. I think since it's Healthy You in 22, I always think about what can I give, what value can I give, and it's really to define what health is. I think if we're going to be healthy, we have to know what it means to be healthy. What is health? And I think, when you look at the World Health Organization's definition of health, it's total physical, mental, and social well-being, not merely the absence of disease or infirmity. And when you look at the Dorland's Medical Dictionary definition of health, it's more than the absence of just symptoms, but 100% function of all body parts and systems. So really, I think health comes down to what we think of as function in the body. Would you agree with that? When you can function and do all the things you want to do, that's really being healthy. Not just how you look and feel, because like the other doctor just said, you can have a problem and maybe not really recognize the severity of that issue. And really your life and health can be at risk. So when it comes to health, I think, and the chiropractic premise is important, because then you know why you would go see a chiropractor. The premise of chiropractic is that the human body is a self-healing, self-regulating organism. And the brain and spinal cord is the master system and controller of that body. So any interference with that system will cause the body a decreased ability to heal and regulate. So it gets back to function again. If we can control function in the body by removing interference to those systems that drive the function, it stands to reason that we can achieve our highest levels of health. And so, like Deborah Lyle is going to talk about, food, the right food is one of those keys to health. But there's three others that we call the four essentials of life: food, water, oxygen, and nerve supply. And it's the nerve supply piece that most people don't think about. And so the reason why I practice chiropractic, especially a corrective care variety of chiropractic, is because I know that if we remove those interferences to the nervous system, you'll not only feel better, but your body will work better. And removing that interference is how your body functions. So we think about the first system to form in the body is that system, the central nervous system, the brain and the spinal cord. And so when the two cells come together, the brain and spinal cord form. Nothing else can happen without it, so that's a clue. And then of all the systems in the body, it's the only one encased in bone. I think that's another important clue. Why would that be? And I think if we don't appreciate that architecture, we won't know how to take care of it. And so most people will say to me, oh, well, so what are you doing? I say, well, I'm a chiropractor. So, oh, thank God I don't need to go see you. But so I think, someday, if I say to you, who's your dentist? You'll say, oh, Dr. So-and-so. Because you know the importance of maintaining good oral hygiene. But I think chiropractic still hasn't gotten through that level of consciousness. And we should do that, right? We should take care of the very spinal structure that's there to protect the communication in our body. And so when the baby's born, I think is when we appreciate that the most. The baby's born, everyone says, what a miracle. We appreciate the birth of a newborn. But I think that we forget pretty quickly that we are miracles and that you're just a bigger baby. You still all the same parts, right? You still all the same parts. So we have to appreciate that intelligence that brought those cells together and in 9 months made you a human being. And then the first thing that developed was the brain, spinal cord, and spinal column. And so we have to appreciate what a miracle we really are in order to take care of that. And I think in the context of function, Christopher Reeves, the famous actor who played Superman, I tell the story a lot because I think in a strange way, it's a chiropractic story. Because he is an example of how we talk about the interruption to that flow of intelligence. He fell off a horse, as you may know, and he broke his neck. And when he broke his neck, he was on a respirator. He was on a pacemaker. He was on a colostomy bag. He couldn't move his limbs, right? But he didn't hurt his legs, he didn't hurt his arms, he didn't hurt his lungs, he didn't hurt his heart, he didn't hurt his GI tract. He hurt his spinal cord. And if you take your finger behind your ear and you feel that bump, you do it. You feel that. That's the level where he got injured, right behind your ear there, that bump in your skull. That's the atlas inside there. That protects the brain stem. And that's where all the function of the body comes from. The nuclei, the cranial nerves in the brainstem. That controls all the function of your body. So in a chiropractic corrective care context, we take careful x-rays and make sure especially that that level is lined up properly because it's going to influence the way you function. And so the symptoms are variable for everybody, but we base it more on the relationship between the structure being normal and the function being normal. And so even though we say, maybe you don't have to break your neck like Mr. Reeves did, but you just have too much pressure there over time, might that be a problem? Right? That could cause an interruption to that flow of intelligence. And so in our office over the years, what we've done is emphasize that relationship, not only to alleviate symptoms, but to teach people that the more you take care of that structure, the longer it will last. That makes sense, doesn't it? We all take care of different things. I know many people that take better care of their automobiles than their own bodies, right? So when you look at the structure of the spine here, I brought this model in. I can stand here for a minute, excuse me. This is the way it should look from the side view. This is the back of the skull. The patient's looking in this direction. So we would take x-rays almost always of the dimension of the spine, and that's sagittal or side view. And then, as well, straight on, this guy's been twisted a few times. It should be nice and straight. So everyone's heard of scoliosis, right? And that would be when the spine is deviating in this kind of fashion, looking at it from the front or back. But from the side view, this is the one that's neglected often, and these are the postural distortions that will cause, ultimately, imbalance, pain, and dysfunction in the body, where the curve of the neck is going forward, that leads to that forward head posture. Loss of the normal curve in the lower back, forward pelvis. That is about 90% of the population. And remember, what's inside of that column? Blood, the nerves, right, the spinal cord. So if I deform that, am I deforming the spinal cord? I am, yeah. And there's a condition that you folks have probably heard of called stenosis. Stenosis is when there's pressure on the spinal cord. Central canal stenosis. So instead of the diameter of the cord being like this, it'll be like this. And those are the people where their legs are falling asleep, they're losing strength, they're losing balance, all kinds of things. And it could be in the neck and it could affect the arms. But this is typical. And so the posture looks like this. The head goes forward, But it's not just that. You don't see people walk like that. You see the head forward and the pelvis forward. And that collapse. And that is the cause of spinal decay. So osteoarthritis, spinal stenosis, degenerative joint disease, degenerative disc disease, all of those diseases are the result of the abnormal alignment and therefore abnormal pressure. And gravity is what causes that. So if we're friends with gravity and we take care of our posture, we take care of our spine, we can avoid all that decay. And so some of the techniques that we use to do that are not only the adjustment and the muscle work that we do, but a technique called non-surgical spinal decompression. You have a little rack card that talks about that. And there's a piece of equipment called the Spine Med. And we are the only provider in the state of Arizona with Spine Med decompression tables. They are the most state-of-the-art for the purpose of reducing stenosis, facet syndrome, herniated discs, bulging discs, degenerative disc disease. So there's often a scenario, and the Mayo Clinic actually came up with a great study to support this, that if you have any of those conditions, you can often avoid epidural injections, cortisone injections, and certainly even surgery. So we've had about an 85 to 95% success rate in treating those conditions in a non-surgical setting, which is pretty exciting. So if you or anyone you know that struggles with those issues, know that spinal decompression is a phenomenal tool to aid in the correction of an abnormal spinal condition. That's what I have for today, and thank you so much for being here. Appreciate it.
Thank you.
How are you on time?
I'd like to
Thank you.
Make one thing.
Yeah.
I just want to say I'm a patient of Dr. Chris's, and what he has done for me is amazing. He is awesome, and I thank you.
Thank you. We appreciate you.
And Chris, you're the reason I walk upright.
You're looking good, Al.
I'm also a patient of Dr. Chris's, and he is amazing.
Awesome.
Yes. Thank you, guys.
I third it.
I'm fourth it. Does anyone have questions for Dr. Condon?
I do have a quick question. I've been reading a lot about what you've been talking about. With the reason that we're not sitting correctly is because we are addicted to our electronic devices, and that's causing a lot of shoulder pain, a lot of the hunching forward. Do you see that? And is that, and how can we prevent that? I mean, I want to follow you out of the building into your office today because I'm so excited to hear what you have to say.
Well, thanks. It's a great question. I think that we joke in the profession that my degree is DC, Doctor of Chiropractic, but I think it's kind of Doctor of Cause. So I want to always teach people to remove the cause, and the ultimate cause of these postural issues is looking down all the time, flexion. And so you see kids, even kids today, they're on the phones, right? And instead of holding the phone here, everyone holds it here. And so when they're in flexion all the time, what happens is the ligaments deform, and as the ligaments deform, they get shorter and tighter, and that deforms the structure. So then the muscles have to try to compensate for that. And unfortunately, they're not strong enough to overcome that deformed ligament. So the ultimate best case scenario is people have a sit-stand workstation where they're spending probably 70% of the time standing, and the gaze is here, rather than like if they're sitting and they have the monitor low and they end up like this, looking at the screen. So habits, right? Yeah, that's a great question. Yeah. Anyone else? Yes.
With what frequency do you use this decompression system?
If it's in the context of corrective care, meaning that the goal is to alleviate the symptom, but also do it long enough, over enough time to see a structural change, because we also do, so we take a before image and an after image. So typically it's a 3 days a week protocol for about 8 weeks. Yeah. And you're on the machine up to about 30 minutes per session.
It makes a nice nap time when you're on it. It's very, very comfortable or relaxing.
Yeah.
Wonderful.
Someone asked about insurance, I think I heard, and just to speak to that briefly, we elected to be out of network. We did a lot of the insurance on the East Coast for 22 years, but insurance is getting worse and worse, not better and better. And so coverages are going down, premiums are going up, patients are getting frustrated because deductibles are going up, co-pays are going up. So we've created a case fee structure for people that want corrective care, and we have affordable payment plan options for that. Okay.
Wonderful. Any other questions?
Well, I'm going to show you what I actually look like from another chiropractor, because I was in a really bad car accident. So I won't take everybody's time, but I'll show you my drawing.
Okay, fine. Thank you. All right, thanks, everybody.
Thank you, Dr. All right. Thanks again to Dr. Condon, wonderful information there. Well, it's time for another drawing. So let's see if we can draw another winner here. Again, your choice of one of the wonderful options from our educators today. We have 8823. No? All righty. 8829.
Yay!
Yeah?
So excited, right?
Heck, yes.
So what do we do?
We have Dr. Therapy with this or one of these gift certificates. So you get to pick your choice.
I'm going to do rosemary.
Okay. All right.
I got you, rosemary.
Wonderful.
Thank you. That's very kind, everybody.
All right. So let's go ahead. We will move on to our next educator today. I'd like to introduce Rosemary Powell with Joyful Life Hypnotherapy. Rosemary Powell, owner of Joyful Life Hypnotherapy, is a board-certified medical support clinical hypnotherapist, fellow of International Board of Hypnotherapy, and facilitator of neuro-linguistic programming. As a licensed registered nurse for 47 years and with a master's degree in education counseling, Rosemary uses hypnotherapy to help others relieve stress, fear, anxiety, and trauma and reach their goals to regain successful, joyful lives. Welcome, Rosemary.
Hi, everybody. I'm going to set my little timer up here so that there's plenty of time for questions as well. I'm so grateful to be here with all of you and those that got up on this beautiful Saturday morning. And what I'd like to share, some of you have already heard, but I just turned 70. And when I was 41, I was realizing that I had some childhood issues I hadn't dealt with. And that I was in a very dysfunctional marriage that I was trying to improve all the time. And it just wasn't working out. And so I sought a counselor. And I went to one, and then another, and then another, and I found one that I connected with. And Linda was also a hypnotherapist. So at the age of 41, with just several months in therapy, I was given tools to live by. As a registered nurse at the time, I was an elementary nurse. I began taking those tools and helping kids with nightmares, sleeping problems, if they were going home to an angry parent that drank a lot. There's sometimes we can't help people escape from those situations. So the kids would come to me. And even a little 6th grader came and he said, Rosemary? I said, yeah. He says, I still use jumper cables to help me sleep. And I know I'd seen him in 1st grade, and that was 6 years later. So there's probably kids out there today that are sleeping better because of the tools that I gave them. Then I went to the high school, and kids would come in with all the high school trauma. Friend died of a drug overdose, car accidents, relationship issues, STD and drug issues, all the traumas that kids go through in school, and as well as challenges with their home life, divorces, broken families. And I began sharing and giving them tools. And a kid could come in a complete full-blown panic attack, hyperventilating, everything. And within a few moments, as I guided them to a peaceful state of mind, they could go back to class. And my health assistant would say, I don't know what you do, but it sure works. Because they would walk out smiling, continuing their education. I also noticed that there, across the building, there were 7 counselors in the counseling office. And yet when there was tragedy on the campus, or something happened with some of their lives, the kids came to me. And I actually dreamed at that time, oh, I'd like to be a full-time counselor. Well, I continued my nursing career, taught nursing school. I helped my student nurses relax with their first procedures and with their tests. And it was just getting more and more fun by the minute. So one morning, about 2 years ago, I woke up, and you know you're in that groggy moment of sleep, and it said, the voice said, you're not supposed to do that nurse job anymore, you're supposed to be a full-time hypnotherapist. I go, whoa! So I thought, now I don't dismiss those voices we get from up there. And I went into my computer right then and wrote my letter of resignation. And it was so, I was just overjoyed, elated, and I promptly went to school to get my certifications. Now, hypnotherapy is not medicine in itself, but I know that the other healthcare people offering here know that our state of mind has a significant effect upon our life and our joy in our life. Okay? So, but today I'd like to share with you, what is hypnosis? So a lot of people come with the feeling that what's going to happen? Is it mind control? Or will I be awake? Or they'll come out of trance and say, that didn't happen because I heard everything you said. And yes, you will. You'll hear everything. So it's a relaxed state of mind. Kind of like when you're zoned out into driving home on a familiar place, and you think about and you plan your dinner, or you think about what happened, or you think about your kids or your life. Okay, you're in a traveler's trance. A relaxed state of mind, doing what's familiar. You're relaxed. There are many types of trances. I think almost everyone in here is old enough to know the famous Olympic diver, Greg Louganis. He has, I believe still has, the world record holder for a number of gold medals in the high board diving. Well, Greg Louganis used hypnotherapy. He would mentally go through his dive over 200 times before he ever got up on the board. Okay, now why would he do that? Because it's all about our mind. So let me share with you a moment the model of the mind. And I'm going to use me to illustrate. It's kind of like, you could picture a big iceberg, that there's a top out there on top. Well, let's just imagine that the model of the mind that's widely accepted in mental health fields is that we have our conscious mind. This is where we make decisions, we logically decide. We have our taste and smell and touch. All of our senses are feeding into this. Now, the conscious mind also kind of does and babbles on. How many's ever had a monkey mind here? It kind of keeps talking, all right? So our conscious mind can only think of one thing at a time, okay? So if we're ruminating about a whole bunch of negative things, then it's difficult to get the good things in there. Okay, so there's our conscious mind. This is what we're dealing with day to day. Part of the conscious mind is like my eyebrows. It's called the critical factor. It is a filtration system. Now, up until the age of about 10 or 11, all of us, the programming to our subconscious mind, that big part of our mind, of our iceberg, was being programmed by events. So, and a child, you know that a child doesn't always perceive things as they are. Like the parents get divorced when you're 6 years old. That was my fault. The mother works 2 jobs to try to support her family. She doesn't love me. All kinds of things that a child kind of comes up with that aren't necessarily true. But in the meantime, that critical factor is open and it's programming beliefs and feelings about yourself. But then, around 10 or 11, the critical mind closes. And when the critical mind's closed like this, the person, even though they are beautiful, they look lovely, they're intelligent, when you give them compliments like that, they'll go, no, not really. Or they might say, thank you, but they don't believe it. Okay? You know, people have difficulty receiving a compliment. It's because down under there's a couple little names that they got when they were little kids. Okay? So all of these things that were programmed when we were young influence our life today. So, I don't want to run out of time. So the unconscious mind is what is our automatic doer. Greg Louganis programmed his doer to do the perfect dive. He didn't get up there and go, okay, I need to do a triple twist, half turn, somersault, pipe this, boom. He couldn't go up there and just think that. He programmed it. Okay? So, our subconscious mind contains our beliefs, the things that we're taught, good and bad, this is this, that is that. It's our habit patterns. Our relationship patterns are in our subconscious mind. And we could think, why do I keep having relationships like that? Why do I attract people like that? Okay? The subconscious mind cannot tell the difference between what's real or imagined. All right, time running. All right, we're supposed to be showing. All right, very good. The subconscious mind wants to move away from pain toward pleasure. It's the creative part of us. It really cannot discern fact from fantasy. So what is hypnosis? Now that we know we have a conscious mind that's kind of small, we have a critical factor that really is kind of closed most of the time, and we have this subconscious mind that I got some stuff my little child believed that this isn't even true, and I don't want to live that angry anymore. I don't want to live that anxious anymore. I don't want to live that up and down sad anymore. I don't want to live that OCD other behavior I do anymore. I want to feel happy about myself and have peace and calm in my life. Okay, so because in hypnosis, the conscious mind is relaxed. It's still there, you can hear everything. The critical factor, the critical factor opens. And the subconscious mind is susceptible to positive programming. It's not mind control, it's positive programming. So I'd like you to experience this now. Would everyone sit with your hands in your lap and your feet flat on the floor? This is just a little guided imagery. You will not be mind controlled. You'll just be relaxed. All right? So take a nice deep breath now and close your eyes. Visualize a candle about 3 feet in front of you. It's a long, white, perfectly straight candlestick with a bright flame on top of it. Look at the flame with a firm but comfortable gaze. See if you can find the brightest spot within the flame, the brilliant light at the center, right at the tip of the wick. Focus your attention on that bright spot and keep your attention right there. Look more deeply into the light with each breath. See if you can find the center of the flame that does not flicker. If your mind wanders to something else, gently bring it back to the bright, calm center. Keep looking into the center of the flame. Now, mentally bring that flame into the center of your forehead, right between your eyebrows. As you locate it there, feel waves of light flowing from the center, filling your entire head with a serene and peaceful warmth. Feel how the energy from this light restores within you a sense of well-being. When your head is completely filled with light, bring the flame down into your chest. Place it in the center of your heart. Let the light expand, pouring through your entire torso, completely filling all of your organs with radiant energy. Let the light go into every space. Feel the warmth and completeness of this beautiful light. Now let the light continue to pour through your arms, flowing all the way to your hands and your fingertips. Feel this beautiful light pour on down through your legs and into your feet. When your entire body is filled with light, allow the light to expand even beyond the limits of your skin. Imagine the light pouring out to the left of you. First, just a few inches. Now, a few feet. Now, let it stream out as far as you can imagine. Forget about my voice. Forget about any other people in the room. Forget about everything. Just feel the radiance of this wondrous light. Now, let the light pour out to the right of you in the same way. It's so easy. Just let it flow. Feel it flowing a few inches, then a few feet, until the light is so brilliant you can't even see the right side of your body. Let it go beyond where the walls were and watch it keep going as far as your mind can imagine. Now let the light pour out in front of you, pouring endlessly into the universe. Feel its energy. All you can see in front of you is wondrous light, as if all things have been replaced by light. Now let the light pour out behind you as far as you can think. Pour the light below you as if the floor has disappeared. And above you as if there is no ceiling, until everywhere you look there is only radiant, peaceful light. Allow yourself to enjoy this clear space. In this space you are quiet, free, and at peace. Here's a resting place for you, a tranquil retreat into open space. And now as you are ready, become aware of your physical body again. Draw the light into your body and take it with you. Gradually notice your head, your torso, arms and legs. Notice the position of your fingers and toes and feel the texture of the floor. Wiggle your fingers and toes, and when you're ready, open your eyes. Take a nice deep breath. Stretch and smile. Stretch it out. So it is in the trance that we can open up. Thank you. That we can open up and we can transform our lives. Thank you.
Thank you, Rosemary. What questions do you have for Rosemary this morning?
I have a question. So Rosemary, you spoke about people's preset ideas or apprehensions about hypnotherapy and not mind control. What is that when you see things on TV where people will be hypnotized and then they'll quack like a duck or do something crazy and they're not in control?
So there are other types of hypnosis.
Yeah.
There's stage hypnosis. That's
Okay.
the duck.
Gotcha.
Okay. and there's Hollywood hypnosis. That's, I'm going to rub my nose and that will make you a murderer, right? Okay. So that's just Hollywood.
Yeah, okay.
Hypnotherapy is really, you will not say or do anything you don't want to say or do.
Thank you.
I can vouch for Rosemary. I'm a client of hers and she's wonderful. Thank you.
Thank you, Kiki.
I will too.
Can I?
As a business owner, I began my business, my office is right across from Rosemary. As Dr. Chris just said, in my mind, I'm 61 years old and I'm thinking hypnotherapy, I'm gonna go like this or I'm gonna quack like a duck. I met her, very calm, said, Debbie, I'm gonna give you a free session, come on in. I'm like, okay. So I did. Okay, I was nervous, I was anxious. And what Rosemary said, I'm good in my skin. I thought, I'm really not anxious, but I was in my business. I began a new business, very anxious. Am I good enough? Am I going to make it in Fountain Hills? All these things going on in my life. I had a few sessions with Rosemary. Yeah, absolutely I am.
Are there any other questions?
Thank you for having me today.
Thank
Chris.
you,
Chamber's
Rosemary.
wonderful. Thank you.
Wonderful.
Thank you.
All right. So you know what time that means, right? We're going to do one more drawing here. So get your tickets ready. All right. We have 8835. Let's try 8824. Yes, all right, wonderful. Joanne, we have Ally Spine or one of two gift certificates. certificates available from Joyful Language. Okay, all right. There you are. Congratulations. All right, everyone. This has been great so far. What wonderful content from our educators this morning. At this time, I would also like to introduce our final speaker this morning, Debbie Romano with Fountain Hills Healthy Heartbeats. Healthy Heartbeats and a certified nutrition and wellness consultant specializing in a clean, whole way food way of eating. Think of her as your personal trainer in nutritional health, with the goal of seeing her clients age gracefully with more energy, confidence, and peace. Debbie, it's all yours.
You know, I came as a health service provider here in Fountain Hills. It was a joy to see our emergency room doctor tell us about the emergency room and what it's doing for our community. And we have Dr. Chris, who the foundation of your beliefs to get to the cause of health. So that was awesome. Rosemary, the mental, the mind, the calming. And here's Debbie. Everybody stand up. We've been sitting too long. I am a nutrition and wellness consultant. My certification, I specialize in nutrition, but it's the mind, body, spirit. We need to move. Let's move, let's eat well, let's do the best we can to make ourselves as healthy as we can naturally. And that's what I'm going to bring up today. I've got about 15 minutes. Not long enough. Anyone who knows me, I can talk about 3 hours when it comes to nutrition and my passion for good health. So I'm going to start today. Everybody just kind of move. We've been sitting, you know, the joints. We had some water. We've got some great fruits, whatever we're eating, move around. Right? Take that deep breath. Sit down. Okay. Right? Good. Does anyone here know healthy nutrition? What do you think about when you hear healthy nutrition? Anybody?
I think about when I always talk about food by God, instead of food by man.
Right? There's a purpose for every fruit and vegetable, thank you, Dr. Chris, on this planet. I do not provide any magic potion. I do not provide any supplements in my program. I just provide the information for anyone to make informed decisions. Majority of Americans today do not know. We're so confused with the internet. So what I thought today is I'm going to concentrate on one thing. And that one thing only is a staple in many American households, and that's nut butters. Okay? Who loves peanut butter? I want to make sure everybody's got, the peanut butter isn't lost in the shuffle. Suzanne, can you take that number 3? Do I have it? Everybody's got one? Okay. When I talk about clean eating, yes, I am certified in plant-based nutrition because Mother Nature, God's given fruits and vegetables on this earth protect us, okay? When we have an apple and that skin of an apple, we've all heard of the word antioxidants. It's all over the place, TV, internet, right? That we want as much antioxidants as we can. What is an antioxidant? Simple. It's your fruits, your vegetables, it's the skin protector that protects the fruit and vegetable from all the other toxins in the world. We as humans are not capable of that. So what happens? That's why we need to eat more. Why they say eat your fruits and vegetables, eat your fruits and vegetables. That's why. And when we eat that, that is our protector. Those are our knights in shining armor. When we eat that take away in our digestive tract. When we eat fruits and vegetables, it takes about 3 hours to digest. When we have an animal protein, your eggs, your dairy, your junk foods, anything like that, about 8 or 9 hours. And then it has to produce bile because those are acidic, and that's the process of digestion. So why not bring in more of the good stuff Our bodies don't have to work as hard. Our livers are filtering beautifully. Our kidneys are working beautifully. Again, I only have 15 minutes, so I'm going to get back to that peanut butter, or otherwise I'm going to get all over it. So just remember, eat your fruits and vegetables because they are protecting. The more you eat, the less pills we have to take. Because that fruits and vegetables, they create magic. You know, fruits and vegetables create nitric oxide, and that's another 3 hours I can go into. But in nutrition, that's a beautiful thing that can bring down a blood pressure naturally. That can open up those arteries and let more oxygen and blood flow through. Okay? So I'm going to start. There is 10 years ago when I started my plant-based journey. And when I say plant-based, I am not a vegan. I am not a trendy anything. I eat clean and I teach clean. 10 years ago, my husband had a quintuple bypass surgery, and that was the reason I am here today. And that's my story of passion, and that's why I'm so passionate, because Mother Nature works. And she does have the magic, and it worked in me, not even knowing, because I was trying to help and be an advocate for my husband. I fell in love with the science of plants. I went back to school, and I still, if you would have asked me 10 years ago, I'm a big nerd in science and plants, and I read all the time. I don't belong to any book clubs because all I want to read is science. I want to read what it does to the body and how to heal our bodies. So if you ever see me reading a book, ask me what it is, and I will share if you have about an hour. Back 10 years ago, when I started my journey, plant-based was unheard of. If it was, you were a hippy-dippy, or you know, she's one of those. All right? Today, I'm thrilled to see the trend, and it is a trend, but I want you to leave today and think of one word. When you hear plant-based, that does not necessarily mean it's healthy. Okay? You can buy a box of anything processed, and it be plant-based, and there's a lot of chemicals and a lot of things in there that's not healthy. I want you to leave today as a plant-based Fountain Hills New Healthy in 2022, but bring the word, be more mindful, and use the word whole. Okay? So when you hear plant-based, remember Debbie Romano, whole foods. Okay? I have here a bag of almonds. This is a whole food. What I'm going to show you today in my little Nut Butter 101, these are the nut butters, okay? They're processed. And I'm going to do a little experiment. And if you don't mind, every time I do a presentation, I love all my guests to text me, to email me, because this is what I love. I want you to go home, look in your cabinet, because you all raised your hand, text me the ingredient list of your nut butter. I love that. So please do that for me today, because you'll forget if you don't do it when you go home. So please do that, because I love the responses, and you will too. I've had so many responses of women, men that come, Debbie, I went to that health food store. That's where I buy all, that's where I buy I'm Mr. or Mrs. Healthy, and I look, and it's full of sugar. So that's what I want to bring up today too. Your whole food, that's what I want you to concentrate on. The more whole it is, if you're going to buy it in a container, the better. Look at the ingredient list. If there's fat in there, I want to see where that fat is from. We need fat. We need healthy fat for brain health. So if it's peanut butter, that's awesome. But there's always oils. I don't want to see a lot of oils, and especially sugar. Fall in love with fruit, fall back in love. We are not a society of type 2 diabetics because we eat too much fruit, okay? I'm going to stand here and I will scream that out to our mountains. Fall in love with fruit again. What I don't want to see is chemically enhanced sugars and added sugars in our products. So, peanut butter number 1. Who's got peanut butter number 1? There's numbers on there. Do you mind? Can you see? A lot of times these manufacturers make it really small. All I want is the ingredient list. And if it's too small, I can read it for you. Go ahead.
Cashews.
Great.
Almonds. Brazil nuts. Flax seeds. Chia seeds. Hazelnuts. Pumpkin seeds. And Celtic sea salt.
Okay. Who likes the sound of that? Right? That's my favorite. And another thing, just because it's healthy doesn't mean you have to eat it. It's a lifestyle, and this is what I teach. You know, this isn't a diet. Bring in good food. It can be tasteful, and I can show you how. And especially with that, I love that because I love seeds and nuts and everything. Does my husband? No. He needs a different kind. But that's mine. Are you going to put that in your cart, or are you going to put it back on the shelf?
I'll try it.
Awesome.
I've never had it.
You got it. Number 2. Who's got peanut butter number 2? Do you want me to read it? Can you read that for me?
Sure.
Go ahead.
Just a minute.
Sure.
Roasted almonds,
Good.
palm oil, sunflower oil, sugar, and salt.
What do we think about this? And you're going to put it in your cart, or are you going to put it back on the shelf?
Back on the shelf. I'm going to put it in the shelf.
You got it. A plus. Number 3.
Right here.
Go ahead.
Dry roasted almonds and sea salt. It says it contains tree nuts, almonds. May contain other tree nuts, cashews.
But main ingredient? Roasted almonds, right? What are we going to do? We're going to keep it. Yay. Number 4.
Roasted almonds, organic, evaporated cane sugar, palm oil, and sea salt.
What do you think? What are we going to do with that? Got it. Number 5. Oh,
Is palm oil a no-no? I've heard controversial things about palm
I'm
oil.
going to say absolutely a no.
Okay.
And what I do is I will, because I knew this was going to be coming up, it's very cheap to make, just like a canola oil, and it's hurting our forests. And I have information here I'd like you to read afterwards. Okay? Number 5. Where's
Dry roasted almonds.
Oh, what do you think of that? Huh? All right, I like it. Number 6.
I have organic dry roasted peanuts, organic expeller pressed palm oil,
Fancy.
organic cane sugar, sea salt.
What are we going to do, Dr. Chris?
Put that back.
You got it. And I'm going to tell you, every single nut butter here, I research, I love this stuff. There are millions of nut butters out there. There are these jars here, Safeway, Bashas', local, health food stores, all over, okay? So just be more aware. Go ahead.
So you're saying that almond butter is better for you than peanut butter?
Not necessarily.
Okay.
You know why? It depends on the taste. If I had young children, almond butter is a little bit more grainier. If I have young children, I will be buying organic peanut butter. There's a difference. Peanuts are very mass produced in this country, and if I was going to get the peanut butter, I'd get organic. Okay? A little creamier taste for the kids.
I have a quick question.
Sure.
So, you know, you talk a lot about sugar, and I'm not a big sugar guy, and I
That's
always
right.
try to tell people to stay away, but when it says dietary fiber 2 grams, total sugars 2 grams, does that become a net zero because of the...
Correct. We don't want any sugar, 0 sugars on our peanuts.
Even with fiber.
Even organic cane sugar. I don't care, you can put the fanciest name in front of a sugar, and it's still sugar. So,
But do you know what I'm saying though, where they say dietary fiber is 2 grams and the total sugar is only 2 grams. Is that still bad? Because doesn't the fiber help you take in the sugar?
Absolutely.
Yeah.
If it was a sugar from a fruit
Yeah.
or a natural sugar, perfect.
Okay.
You got it.
Got it.
Yes. This is just the added sugar, which is a processed sugar.
Okay.
Great question.
Yeah, thanks.
Okay. Anybody else? Yes.
How does the body process sugar from a fruit versus man-made sugar?
Great question. We need to fall in love with fruit. Fruit is a very slow digestion. When you eat your fruit, about 3 hours to digest, and it digests nice and slow, as it should. That's what Mother Nature is supposed to do. When you have a chemically enhanced sugar or an added sugar, your cane sugar, boom, we got that spike. And that is in so many foods. That's why everybody's boom, up and down, up and down. Your fruit is a natural process. It's going to digest beautifully. It will not spike your sugar. If we can, I can go into the glycemic and all that. If you are a diabetic, then there's other fruit that are, you know, we can talk about.
I was going to ask about organic fruit versus regular. What's your opinion?
That's another great question. If I have a client who does not eat fruit at all, on a very low income, has children, you know, things like that, because organic can get expensive, I'm going to weigh and measure. Do I want this person to have regular fruit and not have any? Because, you know, I say, oh my gosh, you have to have organic? Absolutely not. Wash your fruit. Rinse it, wash it. There's sprays now you can do, a little vinegar and water you can rinse with fruit. Absolutely. I buy seasonal. Do I buy organic all the time? I don't. But I also, the Environmental Working Organization changes every year. You can look that up and it'll tell you what to buy this year in the United States of organic. I would suggest spinach, always organic, and apples. Okay, that's my two.
And what are the best fruits?
They're all the best. They're all the best. Find one you love, find a taste that you love, and eat more. Okay? Our taste buds with the chemically enhanced, am I done?
Yeah. You're done, but if there's questions, you've
with the
got
chemically enhanced sugars, I just want to say our taste buds crave that. So when we're talking about addiction, we're addicted to sugars. I just want to absolutely. However, it only takes 2 weeks for our taste buds to change. When we take that concentrated sugar out, boy, when you take a bite of an apple, you're in heaven. Okay? Believe me. Well, thank you so much.
Any other questions for Debbie this morning?
I'd like to give my 2 cents. Oh, Deb too.
2 cents.
My 2 cents. I talk a lot too. I take after my sister. That's my sister, and I'm also a client. And throughout my journey, I've been able to get off cholesterol medicine and high blood pressure medicine. Wow.
Yeah.
So
Great.
she
Did
knows
I
herself,
say
and
take a pill, take this, or anything like that?
and I love what I eat. And I love where I'm at, so thank you.
And I'm a client of Debbie's, and I have to say, I have more steady energy through the day. It just really, I mean, I sometimes am at my office for 12 hours or more, and it's just steady. How do you feel? I'm okay. Anyway, so thank you for all you do, Debbie, and how you encourage always.
All right, everyone. We've got a few more drawings here to give away, so we'll draw some more tickets. We have LA Spine with Dr. Condon gift certificate, Joyful Life Hypnotherapy gift certificate, and then Fountain Hills Healthy Heartbeats has also done a little measuring cup with a coupon.
That is for healthy fats. So when we're going to have a serving of nuts, use that little cup, okay? Instead of bringing the jar to the couch.
That's all you get.
So we're going to draw until these are gone. So our first ticket is going to be 8827. Anybody? 8827? Is that you? Would you like for me to bring you one?
I have one of these kind of.
Yes, you sure can. There you go. You're welcome. Congrats. The next one is 8843.
It's a person right here.
Okay. All right. Next one is 8825.
This is that.
Okay. Bunch of pictures of pain, huh? 8832. 8832. 8820. 8840. No?
Okay, give me an 8830.
Okay. 8817. 8846.
Great.
All right, wonderful.
Oh.
So we have.
She wants both of them.
Joyful Life or the gift coupon.
Oh my gosh, I need to see all of you. I need to go to all of you, so I'm just gonna turn around and I think I'm gonna go see Dr. Spot.
All right, congrats.
Thanks.
8836. 8815. 8850.
That's me.
Yay! Wonderful. Yeah, I didn't know if there was a cord there or not. Your choice.
I'll take one of those.
All right,
Thank you.
congrats.
Thank you.
Next one, let's see, 8830.
Yay!
We have a gift certificate or measuring.
I have that, but I get her today.
Great. 8822. No? Alrighty. 8828. 8849. 8838. Yeah, okay.
All right.
Fantastic. There you are, congrats. All right, everyone, this concludes our program today, Healthy You in 22. Thank you so much for coming today and allowing our educators to present to you. We've gotten a lot of wonderful information this morning, and of course, if you're interested, in connecting with these, you have information with connecting with our educators. You have information in your packets, so please feel free to reach out to them. Thank you, everyone, for coming.
As far as the treats here, please everybody, this is from Mountain View Coffee over by the fountain. I talked to Victoria and I said, listen, can we have gluten-free blueberry muffins? These are gluten-free blueberry muffins made with monk fruit. No cane sugar in here or anything, it's monk fruit and they're absolutely delicious. Take one. The exotic fruit, there's all different mango, just not your typical fruit here. So please take a bite, taste the, just the joy in your mouth when you taste the real fruit of real sugar.
And please feel free to grab some coffee on the way out because it'll make it lighter for us to carry.
Thank you again, everyone.